In this video, I'm going to tell you everything you need to know about shingles from start to finish. We're going to talk about what it is, the pathophysiology, what it looks like, some of the complications that can happen, how to treat it, and most of all, how to prevent it. You can see the chapter headings in the description below. I'm Dr. Laura Soong, and I'm a double board certified dermatologist working in Canada. I also have a background in pharmacy and pharmacology, and I see shingles all the time in my clinical practice. Make sure you stay to the end of this video because I'll answer some common questions that come up when I talk with patients about this diagnosis. So let's jump in, and first let's talk about what is shingles. Shingles is caused by the varicella-zoster virus, or VZV. VZV is known to cause two types of rashes, chickenpox and shingles. These are due to two phases of infection, known as primary infection, which is when chickenpox happens, and reactivation, which is when shingles happens. When you get chickenpox, the virus, or VZV, first enters your body through the respiratory system, usually when you breathe in the droplets from an infected person. This then leads to an acute infection that can make you feel really sick, and so you might have a sore throat, swollen lymph nodes, fevers, just generally feeling pretty crummy. Then you get the chickenpox rash, and you get all these little tiny fluid-filled, extremely itchy blisters that erupt all over the body, usually starting on the face and scalp and then spread towards the arms and legs. These little blisters scab up after a few days and then dry up and heal over, and this whole process lasts about 1 or 2 weeks. You may have had chickenpox when you were a kid, and you might remember that overall it was pretty mild, you were pretty itchy, your parents probably slathered calamine lotion all over you, and then it just kind of went away. In adults though, especially if you've never had chickenpox or in pregnant women who have never been exposed, chickenpox can be much more serious. So it can actually cause some pretty significant complications, such as viral pneumonia. After you have that acute infection or chickenpox, the virus actually hides in your nerves and can stay there quiet and inactive for years, sometimes even your whole life. Your immune system usually tries to keep it under control, but it can't completely get rid of it. And so later on in life, a lot of us, our immune systems start to weaken due to things like aging or certain medications that we might have to take, and the virus can wake up and travel along the nerves in your skin, causing the shingles rash. So now let's talk about shingles. What does it look like and what are the common symptoms? So shingles can show up in different ways, but it usually follows a pretty predictable pattern. So first you might notice some early signs like burning, tingling, itching in one spot of the skin without the rash. And this can last a few days. Then the rash shows up, usually as small fluid-filled blisters, sometimes clear fluid or sometimes bloody, usually on one side of your body, often in a line. It can happen anywhere, but it's most common on your back, abdomen, or even your face. After about 7 to 10 days, the blisters then burst, crust up, and form a scab, and eventually heal over. One thing to know is that shingles is exquisitely painful. The pain comes from inflammation of the nerves and is often described as burning, shooting, sharp pain in the area where the rash is. And so that leads us to what are some of the complications of shingles. So shingles usually heals up without any major issues, but it can cause some serious problems, especially for older adults or those with weakened immune systems. The first thing I always look for as a dermatologist is if the rash is getting really, really scratched or really scabby. It is possible sometimes to get a bacterial infection on top of the shingles rash. And so this could present with spreading redness around the area, worsening fevers or pain, or even like purulent or pus-like drainage. In this case, we usually need to swab it and start you on antibiotics as well. If the rash is on the forehead, around the eyes, or on the nose, and this is really, really important, you need to make sure you see an eye doctor right away, especially if there's other eye symptoms, like you're noticing your vision is blurry, you're having a lot of eye pain, there's redness, or even vision loss, because shingles can actually lead to eye infections, which can cause serious problems, like inflammation of the cornea, the optic nerve, the retina, and all these things can potentially lead to vision loss or blindness. So make sure you see an eye doctor if you're noticing these symptoms. Now, if the rash is on the genital area, it can also cause extremely painful sores in that area. And so some patients also have trouble urinating or voiding, and it can even sometimes infect part of the bladder wall, which can also lead to voiding dysfunction. So if you're having a hard time going pee and you have the shingles, make sure you go to the emergency room. Some people have had to have a catheter inserted to help drain right in the bladder. Now, in rare cases, the virus can also cause inflammation of the brain or the spinal cord, such as meningitis. These are life-threatening and need immediate medical care. So if you have severe headaches, confusion, sudden weakness in one of your limbs, go to the emerge right away. Now, going back to that thing I talked about earlier where shingles is extremely painful, one of the biggest complications is post-herpetic neuralgia, or PHN. This affects about 10 to 20% of people who get shingles, and this risk goes up especially with age, usually in people over the age of 60. So PHN happens when the virus damages the nerves, causing more chronic pain, and so you can get persistent burning, stabbing, aching type pains, and this can last for months, even years after the rash clears up. And this pain can be very hard to treat, and it can really impact your daily life. Now, one thing you might come across online or read about is that steroids or things like prednisone have potentially in the past been used to try to reduce the acute pain that we see with shingles and to try to reduce the risk of PHN. But large and above, over the years, based on studies and clinical experience, steroids don't really seem to help with this, and it can actually increase the risk of the virus spreading or causing secondary bacterial infections. Now let's talk about a really important part of shingles, and that's how to treat it. So remember, shingles is a virus, so we treat it with antiviral medications. It's super important to catch shingles as early as possible, starting the treatment with antiviral medications like valacyclovir, famciclovir, acyclovir. Ideally is the best to be done within the first 72 hours of the rash showing up, and this can reduce the pain, shorten the illness, and lower the risk of complications like that post-herpetic neuralgia we talked about. If you're late to the game, then starting treatment even within 5 days is still helpful. I typically prescribe valacyclovir at the recommended dose of 1,000 milligrams by mouth 3 times a day for 7 to 10 days. Rarely, if people are really sick with shingles, like it has spread more widespread on the body, they're getting the eye symptoms, they're getting headaches, then they might need to be admitted to hospital for intravenous acyclovir. Since pain is also such a big issue, doctors also often prescribe medications for nerve pain. So examples would be gabapentin or pregabalin. These same medications can also help treat post-herpetic neuralgia if that's something you develop. The main thing is that these medications can cause you to feel drowsy or sedated, so you have to be very careful when you first start taking them to see how they affect you. I usually recommend people avoid driving, operating heavy machinery, or doing anything super important when you first start your doses, just to see how the medication sits with you. If you're elderly and you struggle with falls or things like that, then definitely it's important to be very careful taking these medications because they can also increase your risk of falls. Now I want to dive into a really important topic, and that's how can shingles be prevented? The great thing about chickenpox and shingles is that we have vaccines to prevent them. The varicella or chickenpox vaccine was actually first introduced in Canada in 1999. So anyone born before that time likely either had chickenpox or is still susceptible to catching it even if they haven't been vaccinated. I myself was born before 1999. I never got the chickenpox vaccine, but I remember having chickenpox as a kid. If you're not sure if you had chickenpox, you can actually get a blood test to check if you've ever been exposed. This is called serology testing. If you've never had it, you can get the chickenpox vaccine to protect yourself. That said, probably about 90% of the population pre-vaccine era has already had it, even if you can't remember. If you do recall having chickenpox or you're not sure, then vaccination is the most effective way to prevent herpes zoster or shingles and its complications, including post-herpetic neuralgia. The recommended vaccine is called Shingrix. This is a recombinant, so non-live vaccine, and it's approved for adults 50 years and older, or adults 18 years of older who are at risk of developing shingles, for example, due to immunocompromise, they're on medications that suppress the immune system, or if they have a transplant or something like that. So Shingrix is highly effective at reducing the risk of herpes zoster by 97% in individuals aged 50 to 69 years and 91% in those aged 70 and older. That's pretty good odds for a shingles vaccine. And Shingrix also reduces the risk of PHN by about 89% in people aged 70 and older. The vaccine is administered as 2 specific doses, with the first dose given at time 0, the second dose given 2 to 6 months after the first injection. Now, some people may have received an older vaccine called Zostavax, which is a live vaccine for shingles. But interestingly, it's less effective. It's only about 51% effective at preventing shingles overall and 66% effective in reducing the risk of PHN. And so if you've had this vaccine in the past, it's actually recommended to have the shingles vaccine repeated with Shingrix. As a clinical pearl, in the elderly population in particular, they have weakening of the immune system known as immunosenescence. So it's important to have the vaccine that gives longer lasting protection. And actually, after 5 years of getting Zostavax, you're pretty much no longer protected at all. It's basically useless. This is not the case with Shingrix, which lasts at least 10 years, but we think it may actually be good for 20 years if we extrapolate currently existing data. So here's a question. If you've already had shingles, can you still get the Shingrix vaccine? And the answer to that is yes, because you can get shingles over and over again. And the vaccine can help to boost your immunity to prevent this. You can get the vaccine at any time after your shingles rash has fully healed. Another question is, if you had the Shingrix vaccine only 1 dose and you forgot to have the second dose over 6 months away, can you still get the second dose? And the answer is yes. Just go get your second dose as soon as you remember. Now, like any other vaccine, it's important to check to make sure you don't have any allergies to it. If you had a mild reaction like itchiness or redness at the site of a vaccination in the past, you can likely still get Shingrix. But if you've had severe reactions like anaphylaxis, this may be a reason not to get it. It's always best to talk with your healthcare provider about your situation before you move forward. Now, another question I wanted to address that comes up often in clinic is shingles contagious? So let's say you have a shingles rash and you're not sure if it's safe to be out in public or visiting family. So the fact is, in most cases, it's not contagious as long as you keep the rash covered. If someone were to touch the rash, if they've never had chickenpox, never been vaccinated for chickenpox, then they could develop chickenpox from that exposure. Now, if they did have chickenpox or they have been vaccinated, then it's unlikely anything major will happen. Shingles is from the reactivation of the chickenpox virus inside of you. So you can't catch shingles from someone that has shingles. Like I talked about earlier, if you've never had chickenpox, you could get chickenpox from someone who has shingles. Now, one really important thing that I like to emphasize is that it's important to protect young babies and pregnant women. And so avoid being around them if you have shingles, and especially if you have chickenpox, until all your blisters are crusted and healed over. And the reason is, if, for example, a pregnant woman hasn't been vaccinated for chickenpox or never had it and is susceptible, then she could develop chickenpox if she were to contact your shingles rash, and that can be very harmful to a mom as well as the developing baby. Another thing is babies or infants less than 1 year of age have not had their chickenpox vaccine yet, and they're much more susceptible to catching it, and they can get quite sick. So wait until your shingles rash is fully crusted over and healed before you go spend time with those vulnerable people. Well, everyone, that is it. That is a crash course in shingles, everything you need to know. And I hope you learned something. Feel free to drop your questions or comments in the comment section down below. Make sure you subscribe to my channel for more videos like this, and we'll see you in the next one.